about Rock Island County's responses.
Hi, thank you. Rock Island County restaurants and bars, for clarification, all bars and restaurants in Illinois are closed to dine-in guests by proclamation of the governor. Many still are offering food for carry-out and delivery. City and county health inspectors and other city officials, including law enforcement, are handling the enforcement of the closures. Violators could be subject to citation. As far as social gatherings, the CDC has updated its COVID-19 guidance related to social gatherings. CDC has changed guidance for social gatherings and recommends individuals should avoid all social gatherings of groups greater than 10 people. This is a change from the previous recommendation of 50. However, at this point, Governor J.B. Pritzker has not changed his original proclamation of 50 people, which is enforceable standard in Illinois. With the closing of schools and now bars and restaurants in each of our communities, this includes private gatherings of individuals as well as organized gatherings of individuals of greater than 10 people. Social distancing is one of the ways that we can all work together to slow the spread of COVID-19. Your actions today will impact the community as a whole. We understand that people are scared during this uncertain time. Nita Ludwig, Public Health Administrator of Rock Island County Health Department. However, we urge people to listen to the advice of public health professionals and healthcare providers who are working hard to spread accurate information within our community. Please don't spread rumors or play upon the fear of others. We urge you to get your information from reputable sources, including the CDC, the Iowa and Illinois Departments of Public Health, and the health departments of Rock Island and Scott County. Social gatherings. The CDC has updated its COVID-19 guidance related to social gatherings. CDC has changed guidance for social gatherings and recommends individuals should avoid all social gatherings of groups greater than 10. This is a change from previously recommended of 50. With the closing of schools and now bars and restaurants in each of the communities, this includes private gatherings of individuals as well as organized gatherings of individuals of greater than 10. Social distancing is one of the ways we can all work together to slow the spread of COVID-19. And now I will turn it over to Ed Rivers, Director of Scott County Health Department.
Good afternoon. There have been many developments in Iowa today, so let's cover a few of them. This morning, Governor Kim Reynolds issued a proclamation effective at noon today that covers a wide variety of businesses. Restaurants, bars, fitness centers, theaters, casinos, gaming facilities, mass gatherings, and senior centers and adult daycare facilities. The restaurants, bars, fitness centers, theaters, casinos, and gaming facilities must close to the public. However, for restaurants, food and beverages may be sold if they're promptly taken from the premises, such as through carry-out, drive-through, or delivery. Mass gatherings are also affected. We've had some discussion, Nita mentioned it earlier, about what the definition of a mass gathering is and what the number of people is that are affected. For the purposes of this proclamation, mass gatherings means a social, community, spiritual, religious, recreational, leisure, and sporting gathering events of more than 10 people. This is a change from yesterday in our recommendation, including but not limited to parades, festivals, conventions, and fundraisers. A clarification was issued by the Iowa Department of Public Health that it does not include businesses and healthcare facilities, and additional messaging on this issue will be forthcoming. We recognize that there continue to be questions about COVID-19 testing in the community, and we feel it's important to take time and explain how the testing process works for individuals. If you believe you have symptoms, the CDC lists fever, cough, shortness of breath, call ahead to your provider. Describe your symptoms. Your provider will use a process to determine if you need to come in and be evaluated. Even if you have mild symptoms, stay home. If your provider decides they should take a sample for testing, your sample will go to a lab for testing. And even if you give a sample for testing and the test is negative, you're likely still showing signs of illness and can transmit to others. Stay home. For those who are ill with COVID-19 or similar illnesses, you'll be expected to isolate yourself with a positive or a negative test result until you no longer have symptoms. Please follow these guidelines to help us prevent the spread of illness in our community. Additionally, we can all work to prevent the spread of illness by following the recommendations that we have and continue to share. Wash your hands frequently with soap and water or hand sanitizer. Cover your coughs and sneezes with your elbow or a tissue. Maintain social distancing of 6 feet. Honor the visitor policies of hospitals and long-term care facilities to make sure the patients are protected from the spread of the virus. It's also important to describe the differences between Scott and Rock Island County Health Departments and their access to testing numbers. Scott County Health Department will not be able to speak to the number of Scott County residents tested for COVID-19. Private labs in Iowa are not required to report to the Iowa Department of Public Health the number of tests performed. Therefore, the Iowa Department of Public Health will not have a running count of the number of individuals that have been tested for COVID-19. The Iowa Department of Public Health will continue to report on the following: the number of positive tests by county, and the number of individuals monitored by local and state public health in Iowa. Positive test results will be released by the Iowa Department of Public Health, not the local health department.
Nita, did you want to describe the testing and how the reporting will happen in Rock Island County?
Sure. The testing will be done either by the Illinois Department of Public Health labs or commercial labs. If the provider sends it to the Illinois Department of Public Health lab, we issue an authorization code for that. If the provider sends it through a private lab, the provider is supposed to notify public health that there is a person under investigation and let us know the information about that individual. The private lab is also putting it into the Illinois Electronic Disease Reporting System, so we will get results on those people as well. Currently, as of today, 3/17, we have done a total of 27 authorizations for the test, 5 of which are negative and 22 are still pending. I would like to clarify what testing means in Illinois because there has been some confusion. So public health departments do not perform the test. The test consists of a nasopharyngeal swab, and that is done by a provider, either a clinic, emergency room, or urgent care. That swab is then sent to a private lab or the Illinois Department of Public Health laboratories who have the test kits that perform the test on the swab. So local health departments do not directly perform tests or lab work.
Thank you, Nita. Now we're going to hear from Kirby Wynn from the Mississippi Valley Regional Blood Center. Kirby, are you there? Dave, are you able to see Kirby online?
Sorry, Brooke. I'm not able to see him in the participant list, so I don't know what number he might have called in. If he can message me with a phone number here. Let me see. I don't see him. I apologize. I'm going to unmute one phone here and see if this is Kirby, maybe.
Hi there. It sounds like we were muted. Can you hear us now?
Is this Kirby? Or not Kirby, but
Yeah,
someone with Kirby?
Hi. It is, yes. This is Kirby. I'm sorry. We were muted just, I think, on our own device here. I apologize for that. I'm joined here. I'm at the Mississippi Valley Regional Blood Center at our headquarters in Davenport. I have a couple of colleagues with me who will be able to respond to any questions if we get those following this update. We do want you to know that blood centers nationally and in our region are working to prevent a blood shortage. And that's because blood providers, including Mississippi Valley Regional Blood Center, are experiencing a high rate of cancellations. It's happening everywhere. You know the impact that social distancing measures is having on all sectors, and that includes groups that would be hosting mobile blood drives, but they've had to make changes, so they are not. More than 3,000 donations that were on our books for the rest of this month are now off the books because those groups can no longer host, and it changes hour by hour. So I just provide that information to note for media. You hear from us all the time about the need for donors. This is a very serious situation. We do not want to have a blood shortage, and we're working very hard to avoid that, and certainly need your help in highlighting the importance of blood donation, because after all, transfusions aren't being used with patients who have COVID-19. It's someone who's in treatment for cancer, or who needs heart surgery, or we're responding to a trauma, a car accident, or any incident involving blood loss, and those are all situations that just cannot wait for the situation to improve. One of the notes, or one of the issues that comes up repeatedly from the groups hosting mobile blood drives, they're asking about the limit on social gatherings. And we want to emphasize that a blood drive is not a social gathering. It is an essential service necessary for our healthcare continuum. And in fact, as you heard earlier, Governor Reynolds will be coming out, or has already clarified that the proclamation limiting numbers of people congregating does not apply in healthcare settings. And it sounds like there'll be some further clarification along those lines. Our blood center is the provider to all of the hospitals in the Quad Cities area, the Unity Point, Genesis Health Systems, and you can go further afield to other communities like Geneseo, Clinton, DeWitt. We are the provider there. So we really want to emphasize the need for anyone hosting a drive and donors, those eligible. Please come out and donate, whether that's today, tomorrow, or even 3 weeks from now, because this is obviously a long-term situation. And now I'll wrap it up just by saying that we have expanded our hours at our local donation centers. We have 3 in the Quad Cities, and also are adding additional mobile blood drives where we can to replace those that have been called off. I don't want to run through all of those details right now. I'll provide our phone number where anyone interested can call our scheduling team at 563-359-5401, and our web address is bloodcenter, again, bloodcenter.org. And I'll just wrap it up there, and we'll be ready to respond to questions. Not sure who's next, so we'll just mute and listen in.
I believe we have Trish Burnett as well on the line from the American Red Cross. Trish, are you on?
Can you unmute me?
Oh, we can hear you now, Trish.
Okay, sorry, you apparently had me muted. I wasn't able to get through, but thank you. Echoing really what Kirby says, the American Red Cross also collects blood. We manage about 40% of the national supply of blood comes from our donors. And just as with Mississippi Valley, we are also in circumstances of a shortage and are again encouraging everybody to come. As to be expected with both of our organizations, we have really high standards in place during normal situations, and those protocols have increased substantially with this. So it truly is safe for donors to come. We're taking every possible precaution. Again, it is not a social gathering, as he indicated. It is a necessity. It's a life-saving necessity for so many people. So we would encourage anybody that's healthy and eligible to donate to please make a donation appointment. You can go to redcrossblood.org to do a Red Cross drive. We will have one tomorrow, actually, at our Moline office from 8 a.m. to noon, and we will continue doing those weekly for the foreseeable future. But again, anybody who can help, please just get out and donate blood. We're all in this together right now, and just want to encourage everybody to help that situation. It's something we can individually do that does make a difference. Thank you, Brooke.
Thank you, Trish, and to all of our speakers. Next, we're going to go to our questions portion of our briefing. We're going to look at the chat function here and see the questions that have come in, and then send them to each of our speakers as they relate. The first question, and perhaps Ed could speak to this since he's in the room with me and I get to call on him first, says the restrictions are getting much stricter. Does that indicate health officials are learning the spread may be airborne, not by droplets?
No. The advice we continue to hear that is an airborne droplet, which is much less communicable than an airborne disease.
Okay. Next question we have on here. How many test kits are available at local hospitals? I know we don't have a health system representative on the call with us today. Do we have anything to add that would help them understand this?
No, that information would have to come from each provider.
Okay, go ahead, Nita.
Yeah, I was just going to reiterate that the test kits are really at the laboratories. I think maybe what this is referring to are the swabs and the viral media that the hospitals, when they take the swab, they put that into. And again, we don't know the answer to that. That would have to come from the hospital.
Okay, we have another question here. Do the Illinois and Iowa recommendations include the closure of malls and stores? Should those places restrict access to no more than 10 people? Perhaps we can each give some information for our states. I know ours is still new here on the Iowa side. Ed, is there anything specific in the guidance that discusses that?
They do not elaborate in the proclamation itself, but we received clarification from the Iowa Department of Public Health that the mass gathering advice of 10 or more people does not include businesses or healthcare facilities.
Nita, do you have anything to add on the Illinois requirements that they've received from the state?
Yeah, I think it is much similar to Iowa at this point.
Okay. Next question, can people hike or bike if they maintain 6-foot distance?
Yes.
Yes, I would say so. That is an outdoor event and you're maintaining a safe social distance.
Are grocery stores expected to limit access to the building to no more than 10 people at a time?
In Iowa, as I understand it, they would be classified as a business, so the answer would be no.
Correct, and I believe that it goes the same for the Illinois side. There has not been a limit in grocery stores to this point.
Are Rock Island or Scott County providers using private labs that you are aware? Ed?
I'm not aware.
For the Illinois side, yes, we have known of a few, and I believe Community Healthcare is also using a private lab at this time.
I'm sorry, I misunderstood the question. Yes, our medical providers are employing private labs.
Another question we have, are there additional accommodations for the hard of hearing who can't access drive-through services like banks and restaurants? This sounds like perhaps this could be a question that could be answered by some of the businesses in our community. We continue to make sure that information we're providing is available there, and I know the media has some venues that they're providing some of that information, but perhaps there could be some questions to some of those service providers who are making some accommodations at this point. Is it the case that we don't appear to have a confirmed case yet? Good news or bad news?
Well, this is Nita. I don't think it's either. I think we just don't have enough results yet to know if we have a positive case, but I think we should all assume that this virus is in the community and practice the social distancing guidance that we're given.
Nita, I believe this next question implies to some of the stats that you had. How long is the test good for? We had 20 undetermined, I'm assuming it's test results yesterday, and 22 today. Why is it taking so long?
Yes, and the answer is I don't specifically know the answer to that. We do have to get the test to the state lab within 72 hours, but they will keep it on ice or however they need to for as long as they need it. And I do not know the answer to why is it taking so long. We have posed that question ourselves to the Illinois Department of Public Health. All we know is that our 22 results are still pending.
We have another question regarding some of the restrictions that have been put in place. Some parts of the country are asking people to shelter in place. Why aren't we doing that? Ed, do we have any indication for our state?
We don't. The areas where shelter in place is occurring are areas where the outbreak is broad. There are a number of cases in the community. We're not there yet. And as we saw this morning, the recommendations are changing daily. If there's a need to do this, then the governor's office will indicate that.
Is it possible to get the virus from someone who has prepared your food, touching the food or box?
I don't know the answer to that.
We can perhaps try to find out more information. They're learning more about the virus every day based on new information they're receiving. So hopefully we can have a better understanding in the upcoming days.
I would agree with all of that. I'm sorry, Brooke. I would just say, you know, that's why it is very important to practice the frequent hand washing and to also practice, you know, cleaning and disinfecting all the surfaces that are routinely touched.
We have another question. Is there any discussion of suspending mail delivery since mail is touched many times in the chain from sender to receiver? Have you, either of you, heard any discussions of this so far?
No.
No, I have not.
We have a question that I think you may have addressed, Ed, earlier, but perhaps we can reiterate. What are Scott County latest test and result numbers?
Well, as I noted in my remarks, we do not have testing numbers, and we will not have testing numbers moving forward. As for results, if we have a positive result, it will be listed as a confirmed case by the Iowa Department of Public Health.
Yeah, I would just encourage everyone not to focus so much on the numbers of tests done, but rather if we do have a positive, like Ed said, and also to really stress the social distancing that we really want the community to follow to try to flatten out this curve so that our healthcare systems are not overwhelmed.
Do you feel the testing has caught up with the need for testing in Rock Island and Scott counties?
Well, I will speak for Rock Island County. No, I think that our providers would still like the ability to test more people. Yeah, I don't think we're there yet.
As we discussed in Scott County, the Iowa Department of Public Health has allowed private providers to do the testing, and we're not aware of their ability or how many cases they are doing.
Sorry, I'm just trying to catch up in our line of questions here. I apologize if this has already been asked, but what recommendations do you have when it comes to public transit?
Yeah, the same advice applies. Use social distancing. Try to stay as 6 feet away from others if you can. In our building here in Scott County, we have posted a sign that asks that no more than 4 people get on the elevator to come upstairs. If you're waiting for a bus and there are a number of people on it, you'll have to make your own individual decision whether you can maintain that 6-foot social distancing.
There was again a question here on testing numbers. Perhaps Rock Island County could put their testing numbers into the chat here so we can move on to the next question. That way everyone can see that information. We have another question. This perhaps would be follow-up to what Nita had described. Can you clarify the journey of a test result? So someone feels sick with COVID-like symptoms. They take a test at their doctor's office. Where do those results go exactly? How long can people expect results to take?
Did you want me to take that one, Brooke?
I mean, you had started with your description of the process and the length. If you want to take that, and then we can add anything as needed.
Sure. So, first of all, a person that is feeling ill and thinks they may have this should call ahead. That's another very important key point. Call ahead to their provider or clinic or ER to let them know they're having these symptoms and they're going to come in. So when they go into whatever provider that is, the provider knows that they need a mask, and then they will be escorted into an isolation room or a room that they can shut the door. They will be tested for influenza and strep, and a provider will determine if they do not have those things, whether or not they feel like they should be tested for COVID-19. At that point in Illinois, they would call the health department and give us the background and the name of the individual and whether or not they should be tested. And of course, the health department would give them an authorization code to send in the swab to the Illinois Department of Public Health Laboratory, or they can send that swab to a private lab here. When we get the results, and we had been told it would be 1 to 2 days, and that currently is not happening. We're not sure if there's a backlog because they're very busy. We're not sure at this point. But when we get a result, that will come to the local health department, and the local health department will share that the result back to the provider or the emergency physician, whoever saw that patient on that day. Did that answer the question?
Thank you, Nita. Another question, how would you assess the community's response to the recommendations so far?
I think so far it's good. We came out Friday with recommendations, and I was watching KWQC Friday night, and they had changed the format of their newscast so they could stay 6 feet apart. I think people are getting the message. They realize since there's no vaccine, there's no therapeutics for it, it's a matter of personal responsibility to help us stop the spread of this disease.
And I would just add on the Illinois side, the calls that we're getting for authorization for testing seem to be very legitimate, that people legitimately have some of the symptoms associated with COVID-19. So that makes me encouraged that we're not seeing people flood the healthcare systems that don't have the symptoms that we're associating with the COVID-19.
This, Ed, I think relates to the state of Iowa regarding testing numbers. Whose decision is that not to release numbers?
The Iowa Department of Public Health has made positive test results reportable. No public entity has the number of tests performed to release. Have the hospital's visitor restrictions changed, and if so, what is new since late last week? It's our understanding we've had just basic communication with them that they're releasing information on that. I believe there may have been a press release that went out earlier today on some information. So perhaps you could find that there, but that's not our information that we have. I'll take Graham's.
Okay, so we have a question here. How does the health department decide whether or not to give authorization, or what criteria would authorization to test be denied?
It is not our authority to do this. We are not involved in the testing process. That is between the medical provider and the testing laboratory.
Nita, did you want to respond since you're providing some authorization in the Rock Island County response?
Sure. We are following the CDC and the Illinois Department of Public Health criteria for people that need testing, and that is what I think everyone's heard before, whether they have had travel to an affected area or they've had a lot of close contact with a known case of COVID-19, but it is also, like I said earlier, if they have certain symptoms, the fever, shortness of breath, cough, etc., and they test negative for influenza and they test negative for strep, that is also an indication that their symptoms, there is an unknown source and they could be tested. It is also up to the provider in their best judgment. So if the provider feels that this is a case that they would like to see tested, then the health department does give that authorization code. And the authorization code is really more for the laboratory because that specimen is sent with that same code to the department lab.
Okay, we'll take this last question that we have posted and then we'll be able to wrap up for today. We haven't had a positive test yet. Is that an indication we are flattening the curve? Any thoughts on that, Ed?
Well, remember that the disease has an incubation period of between 7 and 14 days, so any action we take today won't be manifested for that period. However, I like what Dr. Katz, our medical director, said on Friday. If we're successful, people will think that we overreacted.
Okay, thank you all for joining us today. We appreciate your interest in this, and we hope to continue to give you regular updates, so please stay in tune for any additional press briefing information that we send out. We appreciate your time and your assistance in getting this information out. Thank you.
Thank you.